Osteocartilaginous Exostoses or Osteochondromas. Osteochondromas are the commonest of benign cartilage-forming lesions, though designated and discussed with neoplasms. Exostosis or osteochondroma is not a true tumor, but is regarded as a disorder of growth and development. Exostoses arise from metaphyses of long bones as exophytic lesions, most commonly lower femur and upper tibia like around knee and upper humerus, but may also be found in other bones such as the scapula or ilium. They are discovered most commonly in late childhood or adolescence and are more frequent in males. They may remain asymptomatic and discovered as an incidental radiographic finding or may produce obvious deformity. Pathogenesis. Hereditary exostoses are associated with germline loss of function mutations in either the EXT1 or the EXT2 gene, and subsequent loss of the remaining wild-type allele in chondrocytes of the growth plate. Reduced expression of EXT1 or EXT2 also has been observed in sporadic osteochondromas. These genes encode enzymes that synthesize heparan sulfate glycosaminoglycans. The reduced or abnormal glycosaminoglycans may prevent normal diffusion of hedgehog factors, which are local regulators of cartilage growth, thereby disrupting chondrocyte differentiation and skeletal development. Morphologic features. Gross appearance. Osteochondromas have a broad or narrow base, may be either sessile or pedunculated, which is continuous with the cortical bone. They protrude exophytically as mushroom-shaped, cartilage-capped lesions enclosing well-formed cortical bone and marrow. Microscopic appearance. They are composed of outer cap composed of mature cartilage resembling epiphyseal cartilage and the inner mature lamellar bone and bone marrow.